wonderful speaker about around the world. Obviously, we need to talk, we need to know what happened with the 7-star scope. It's the fusion, it's the new fusion of the two images. One specific micro camera and ultrasound. You know that our history in pain management, the first is we make many procedures bleeding. After that, we use the X-ray. After that, we use the MRI, TAP, PEC-TAP, and another device. But this represents in real time with invasive or minimum invasive the combination in the same workstation of two devices. Ultrasound, advanced ultrasound, and micro camera with 7-star scope. This is a video presentation of my clinic, of my hospital. I work in one university hospital. It's in Spanish, sorry, because I both in Spanish and English, but it's possible for you to read the video presentation.
Porque es la visualización directa del target a tratar, es decir,
this is the laser. After that, I explain for you step by step. But it's important for me that you look that it's easy to use in our surgery room, because it's possible to identify the area, the specific area that you need to treat. Imagine if you need to look one foramen, if you need to look one sacral approach, if you need to look one muscle, one fascia, or dental entrapment. I have a lot of experience with dental entrapment for transperineal way and posterior way. And this is, I show for you my principal image and video after this presentation. Look. It's like endoscopic and laparoscopic way, okay? But it's the first time that we use the microscope in our habitual practice, because always all the treatment before we need to use the X-ray and advanced ultrasound. Look the cannula. This is we have two cannula in this moment, short and large, and this technique represents one important advantage in this moment of the use of the echography and the machine ultrasound and video endoscopy in the real time is the best for us and is the best for the patient too. We are very happy with this combination. Look, it's coach, it's coach. If you have any doubts after the presentation, after the symposium, ask me or ask the dean of quantum medical for any doubt. And this is my protocol. This is Ibro laser protocol that we use through microscopic, but to put many scars inside of the epidural space, or maybe in the muscle, in the fascia, or to destroy it, and to a posterior aspiration of the scar. Imagine that if you have one scar, you have maybe one entrapment of the nerve, or maybe you have any problem of the traction in the muscle or in the nerve, and you need to pull to evaluate after. In my case, I use the elastographic. Elastographic is a quantitative elastography, and I use cryotherapy to look how happen when you use the cryotherapy. It's possible to look the ice ball around the nerve, and this is good for us because it's possible for you to look exactly the side of the target. This is my advanced ultrasound. This is a combination, not only this ultrasound, I combine another ultrasound for 5D and trans-illumination, because I am fan of the advanced ultrasound. So represent for me is this software and this technique is cardiology is used for to identify the principal alteration in the heart. And this is more important because it's possible for you to look the whole and produce the ice ball in the tissue. Pelvic pain. In this moment, I want to show this is no normal lecture. I want to show my experience with video, photo, for you understand the action and the use of the microscope. 7-star scope is with advanced ultrasound. This is my protocol, figure laser and protocol for pudendal entrapment, for pudendal release. Imagine that I prefer, for example, when you use for pudendal relief, local anesthetic or corticosteroid, maybe disappear the balloon in 1 hour. With this technique that I use with PRP and hyaluronic acid around the nerve, with this technique, it's possible to obtain this procedure with effectivity in more or less 3 weeks. And this is good for when you compare the electrophysiological study before and after the treatment. It's good when you have one denervation, or maybe when you have a loss of the velocity around the nerve in this process. I'm working every day with my electrophysiological, with my neurophysiological doctor, neurophysiologist, and they showed me this report, and I am very happy with this. In the image of the right, it's possible to look the pudendal nerve in the alpha canal. When you make the hydrodissection, you obtain this image in 5D. The technique is simple because you have any port, and it's possible to use in 2 ways for the pudendal entrapment, for posterior way and for intraperineal or transperineal way. I prefer transperineal because I have more effectivity. I have expert in pelvic floor, and for this reason I receive many patients every week. And normally in my surgery room I have 4 or 5 patients diary of pelvic pain. And for this reason we need to change my protocol for to use this technology for to increase the quality of life of my patients. For this reason, in this moment, we combine in 80% both techniques, posterior way and transperineal way. This is another image. And look, before and after. In the video, in this video, it's possible to look the white area that is when the pudendal is entrapment. And after release, it's possible to look the donut image that you have the possibility to look the structural area, normal structural area, and it's more easy. I compare this and I improve this with advanced ultrasound with 3-dimensional study and with elastography. Quantitative elastography is good for us because it's important to measure the degree of deformation or the degree of the elasticity that you have in the muscle, because sometimes you don't have collapse of the alpha canal, you have hypertone of muscle, and this is more important because you put Botox and maybe you realize one hydrodissection and you obtain the best result for the patient, and the patients are very happy with this treatment. Look at my surgery room, working for transperineal way, and in the spine. Remember that this is a symposium. If you have any question in the symposium, it's no problem for me. For the spine, it's a big problem in this moment. Remember the patient that suffered arthrodesis or maybe fibrosis, scar in the spine, but I have the opportunity to the control with this technique. Is like epiduroscopy. I prefer to put the fibrosis with the laser. No, it's the same laser that you use in laboratory practice for pain management. I use one special platform that the name is a photona laser, and the use that I use every day is the neodymium jet. It's a special fiber with a special longitude of warp that I use in this case for to put, but to prevent the principal complication of the laser. For this reason, I want to present my protocol that is for to put this fibrosis. It's easy because the microscopic have a good resolution. When you combine and we destroy it, you put the scar, it's possible to obtain the result in only 5 minutes, 10 minutes when you identify very good the area. Look, the combination, this is not in the spine, this is in the muscle, this is the scar in the muscle after the arthrodesis. And you have another important scar, more or less 7 centimeters, and I put in longitudinal and transversal area to fracture this scar to prevent the traction and the neuropathic pain near of the spine, of the spine. Okay, and this is a compromission, the fracture of the scar with 3-dimensional approach. This is the scar, and with the laser you put here, put, and it's good because it's possible to improve with the microendoscopy. In pelvic floor, and the spine, I use the advanced ultrasound, I use the fusion because it's important to prevent complications and to understand what happened before and after the treatment with the use of the microendoscopy. Look, the aqua canal, this is by protocol with the cat sign. This is a face of the cat or maybe the dog. Look, one eyes and the nose. And this is when you use PRP or maybe local anesthetic, you obtain this image, always in 100%. When you realize the hydrodissation in the alcohol can advanced ultrasound. And look, this is the elastographic. The color red represent in the quantitative, the color red represents the area that is much hard, and the blue that is much soft. For this reason, it's possible to put Botox or any drug that you need to relax this muscle to prevent the entrapment. Remember, we need to treat the nerve and we need to treat the myofascial syndrome. This is more important for the pain management. Cancer pain, obviously, is my favorite device in this moment because I am working in one oncology hospital and it's important to destroy the cancer, the primary cancer or the metastasis. I use the laser or maybe cryotherapy through this device, and it's good to identify the metabolic agitation that the peptide or any image showed me, which is the site that I need to treat for this patient. This is my protocol. This is a fibro laser, neodymium laser. It's administered through the peripheral optical fiber, and I want to show how it's working. For example, this is the laser. You have one important opportunity because imagine that you want to combine with this machine. Is you want to put a radio frequency needle. Through radio frequency needle, it's possible for you to pass the fiber, and you have 2 combinations for a treat your patient. You imagine that you have one tumor and you want to make ablative radio frequency, you put in the exactly inside the metastasis, and it's possible for you the first use the laser, and after that you prepare the patient for the ablative radio frequency in the same side. It's a good opportunity. This is a good look. Sorry. This is it. It's the ablative. Look the scar. And you have the contour immediately. This is possible to do through the microendoscopy. Okay? This is my advanced ultrasound for the spine and for the pancreatic cancer. When the patient suffers metastasis in the posterior way and this is impossible to the access, I prefer the trans-abdominal anterior way through the liver and the stomach. Possibly, when I use the microendoscopy, it's better for the patient and it's more safety for me too. This is my partner, my surgeon, general surgeon. This is my friend, Dr. Tamamet. We're working together in this kind of cancer. And for me, it's a pleasure to work with him, every day. This is the continuous Doppler in 4D. It's important to get the control of the celiac area. And this is the right porta, the left, and this is the combination of the different talk with advanced ultrasound for the use of the microscope. In regenerative medicine, I am fan of regenerative medicine. I use regenerative medicine, stem cell, PRP, hyaluronic acid, and the stromal vascular fraction in the last 50 years. And obviously, is to have a good option too to management your patient with degenerative medicine. Remember, the patient needs neurostimulation, the patient needs physical therapy, the patient needs regenerative medicine, and sometimes now the patient needs magnetic and electric brain stimulation. This is good for the patient because you need have one global concept of the treatment of pain. In cryotherapy, this is another target for me because with ultrasound it's possible to look the gas in the point of the cannula. But in this moment, it's good for us. I think that I will have one important image maybe for the lecture, sorry, but I don't put in this presentation that it's possible for you to look the bolus eyes. Okay? I'll show more later in the lecture the bolus eye through the 7 scope. This is the surprise for the quantum medical. We use, we want in the next bone in March of this year to use for the first time for the erectile dysfunction this machine. This is in cadaveric. I have one protocol that is similar to PIT-SHOT in United States, but in Spain, the name is Human Protocol, and I put a stem cell of PRP after the shock wave for the erectile dysfunction, for the patient that suffer chronic pain, pelvic pain for the men. No? And we need to improve how many milliliters, how many volume is the ideal for each patient. Because imagine that all the patients, it's not possible that receive the same volume. And it's possible to calculate perfect with the microendoscope because you look the cavernous score and you put the stem cell or maybe PRP to increase the flow and for this reason resolve the erectile dysfunction. This is me, this is a dissection of the penis, and possibly the pudendal posterior approach is another target for me for to combine with this device. This is my presentation for the symposium. Thank you so much. If you have any question, remember that I live in Madrid, and for our best team of the world is Ala Madrid, is Football Club Madrid. In this moment, you have in this place of the world, you have Cristiano Ronaldo, and thank you so much.